Your doctors couldn't find anything wrong with you. All your tests have come back negative. Well, if you've been sick for this long and no one can find anything wrong with you, so that phrase is frequently used by the TMS mind body neuroplastic curable pain camp to invalidate and medically gaslight people. That was an entire book published using that phrase. But I've come across it a bunch when I've read of the chronic pain science, and I went to a pain camp. I've had doctors tell me that. I've had friends and neighbors tell me that. If you do think you have stress related illness that's not nothing's wrong in your body, then by all means, please make yourself feel better and reassure yourself and calm your central nervous system and get better using that method. However, that has never worked for me, and that's because although my doctors couldn't find anything wrong with me, there has frequently and repeatedly been things that are objectively and physiologically wrong with me. And the fact that my doctors couldn't find them had no bearing on reality. The reality is there are lots of things that can go wrong and cause chronic pain in people's bodies that we don't even have tests for. There are things that we have tests for, and the only people doing those tests are medical researchers. So you can find, medical studies saying, oh, we did this test, we found this on a biopsy, but no one else in the entire world is doing those tests for the average patient in clinical practice. For example, a person can have congenital neuroproliferative or acquired neuroproliferative vulvar vestibulodynia and have neuroproliferation visible on a certain kind of biopsy staining. There's only a few doctors sending out samples after surgery to perform that staining to prove that the patient had neuroproliferation. A lot of the doctors that are even, thankfully good enough to perform this procedure on people, they don't do this biopsy. So there's not getting evidence compiled that that was the cause. A lot of patients with pudendal neuralgia with specific medical histories that indicate this end up getting pudendal nerve entrapment surgery. And if you talk to a lot of the surgeons that do this surgery, they have found that MRIs, MRNs, 3T MRIs are not showing the pudendal nerve entrapment that they are finding when they open patients up who are symptomatic for surgery. They're only finding the nerve entrapment upon actually having to go through the surgery. So that's something physiologically wrong that no doctor would ever find just by visually examining the outside of your body and even sending you for MRIs. My whole life is unfortunately a great example of why, but the doctors can't find anything wrong with you is bullshit. I spent 3 years suffering with occipital migraines. There's no test that proves that you have migraines and tells you where it's coming from. This is what was causing them. I was on high dose estrogen combined oral contraceptives for those 3 years that I was having the horrible repeated weekly, monthly occipital migraines. There is no test that could show that. If you looked at my medical history and you were a smart doctor who believed that I had a problem that was not created by my faulty body, you might have looked at my drugs that I was on and maybe put two and two together. But instead, I am the one that had to. I spent those same 3 years with repeated gallbladder attacks multiple times per week after eating fatty meals. I would get horrible cramps and spasms under my right rib cage that would last for hours. At one point, I went to the ER during an attack and my lipase was above high normal, but that was the only marker they ever found of something wrong. And so they just told me there's nothing wrong with you and it's all in your head and we don't know, and go home. Just live with these, the attacks were so bad, I couldn't breathe during the gallbladder attacks. I couldn't move. They put me through a battery of digestive function tests and they all came back negative, including a gallbladder test. And I was just told yeah, there's nothing wrong with you. The doctors can't find anything wrong. You've had all these tests. So again, we have lots of medical journal articles showing the increased risk of gallbladder disease on patients, on reproductive age women using hormonal contraceptives, and also an association of relationships between estrogen and gallbladder sludge and dysfunction. The cholecystectomy up here, that's gallbladder removal. So all I had to do to make that disabling, horrible problem go away was stop the oral contraceptive pill. If you've been following me for a while, you already know, and you might remember, that this same medication, except the low-dose version of the birth control pill, which I was put on at age 15 when I hadn't even gotten my period, really, and I was on it for the next 15 years on and off, right before I started the high-dose estrogen pill that caused the gallbladder and migraines, that caused provoked vestibulodynia. The low-dose pill can suppress sex hormone production and affect sex hormone binding globulin, which is in the lip is triggered by the synthetic estrogens taken orally in the pill, triggers the liver to produce more of this blood globulin that binds to circulating sex hormones. So you have multiple mechanisms by which oral contraceptive pills can lower the endogenous, the body's own production of sex hormones, which can lead downstream to not having sufficient levels in the urogenital, so the urinary and genital tract, the bladder and the vagina and the vestibule and the vulva, including the clitoris, and there's glands in the vestibule. They all are rich in hormone receptors, both estrogen and testosterone. They're really important for sexual function. We kind of know that. There's a whole lot of science already about how hormonal insufficiency in menopause causes a lot of the symptoms of vulvodynia and interstitial cystitis that I was dealing with starting at age 22, which is almost 20 years ago for me. I mean, I kind of had it all. I had vulvar genital itching from the low hormones. I had leakage from the atrophied tissue around my urethra. So I would like drip after I went to the bathroom, and I just was like, what is wrong with me? Why am I like an 80-year-old woman at age 28? I had frequent UTIs caused by the low estrogen. I think I was more susceptible to yeast infections from the lack of protective lubrication. The Skene's glands on either side of the urethra are responsive to testosterone, and I had below normal testosterone show up on my blood work as early as 2012 when I had all these illnesses. I was looking for answers, and I said to the endocrinologist, could this be part of the puzzle? Could this have anything to do with the symptoms in my urinary and genital tract, this low testosterone? And they said no. I've never had my estrogen test higher than the mid-30s. Normal estradiol and reproductive age women can go up to the 300s. Mine has been like 28, which is below 30, which is in the normal range for menopausal women. So my point is that even when my doctors, if they paid attention and cared, could say something is wrong, they saw those wrong results and didn't care. They dismissed them. I also had visible atrophy. Like for a person, you're a gynecologist, they should know what a healthy and normal size vulvovaginal tract looks like and healthy tissues. And after I saw a specialist, he said, like, you're atrophied, your clitoris is atrophied, it's small, your labia minora are atrophied, your tissue is pale except it's extra red at the gland. So there were visual findings, but the average OBGYN doesn't know enough about vulvovaginal health to identify those things because we have a history, a documentable and verifiable history of not prioritizing women's sexual health unless it relates to their ability to give birth. And we have a narrative starting with Freud and maybe even earlier, like with the Greeks, of attributing female problems, reproductive problems, to the scary part of the body that didn't even get studied by doctors, to psychological factors. That's been a narrative for centuries. I didn't even get to my knees yet. I've had horrible knee pain for the last 6 months, and I have been asking for an MRI for the last 4 months, and I have been asking for a Lyme disease test because I'm a wild mushroom forager in a highly tick-borne disease epicenter in California, and I have not been able to get these tests. An MRI is the only test that will show structural problems with my knees like bursitis and meniscus tears, tendonitis, fat pad impingement. So yeah, they've done an x-ray and they've done some blood work and they're kind of like, well, they're all negative, so we don't know what it could be. Well, with just a little bit of searching in medical journal articles, I found like 12 different things it could be, and we have not tested for any of them yet. And with the nerve pain from my pudendal neuralgia, I've posted a lot about how I have not been able to get any imaging or nerve conduction tests. I think an MR neurogram would be appropriate and reasonable. I can't get any doctors to do one, and there really isn't there's no invention of ultrasound or 3T MRIs or, for the clitoral area in females. They have these tests for males, ultrasound, but they don't even exist. They exist for the vagina, but not for the female external genitalia. The only places I can see reference to such technology even existing is in a handful of medical journal articles. So given all that, when someone tells me, but they couldn't find anything wrong with you, it just makes me want to laugh or cry. Actually, it makes me want to cry because it's meaningless. It's a meaningless statement. To me, they can't find anything wrong means they didn't look hard enough. It means their body of research is insufficient to properly diagnose this. It means they haven't looked at the evidence we do have hard enough. The last thing I think this means is that it's psychosomatic and in your head.